Hello friends, this is Dr. Anand, and today I'm going to discuss very important point related to the COVID-19. So I'm going to discuss this both. The title of today's talk is Managing COVID-19 Multiple Organ Problems Using Mesenchymal Stem Cell, and we are going to search about this possibility, whether it is possible or not. So this particular photograph has a lot of signaling pathways, very complex, and I'm going to discuss one by one. So this entire photograph is showing a potential mechanism of action of mesenchymal stem cell, that is MSC, to reduce lung injury and acute respiratory distress syndrome after COVID-19 infection. So this part is going to deal how this mesenchymal stem cell may help when the patient is suffering from the COVID-19. So this is published in very good journal called Thorax recently, and our group also published this paper in Stem Cells Review and Report in 2020. So if you see that COVID-19 infection here, that is SARS-CoV-2 virus, which is infecting the lung alveolar cell. So this particular COVID-19, as we know, bind to the lung cells using S protein, that is type 2 alveolar cell. So it binds to ACE2 receptor, which is present at type 2 alveolar cell, not at type 1 alveolar cell. So that is good part, in fact, that these viruses can bind only type 2 alveolar cells. So once it binds, because it does the lytic cycle, so it creates injury, and because of the injury to the tissue, the neutrophil and monocyte start rushing to manage this problem. Once it comes here, you see it starts secreting several pro-inflammatory cytokines, that is IL-1 beta, IL-6, IL-8, TNF-alpha, and then again, because of this, triggers a strong pro-inflammatory cytokine actions and cytokine storm, which is well known now. So create the tissue injury again and create more problem. So at the same time, if you see here, now what happens once this COVID-19 infection comes, as I told, this triggers a lot of cytokines and bad pro-inflammatory cytokines. So IFN gamma, and TGF beta 1, TNF alpha. So this causes the myofibroblast differentiation and forms the collagen deposition, and then causes the lung fibrosis, and lung is compromised and unable to exchange the oxygen properly. At the same time, so what happens? Once you inject the mesenchymal stem cell, which is here, and you can see it is here also. So because it's complex cycle, so just it is divided into part here. So once it is injected, it secretes a lot of good cytokines, that is anti-inflammatory cytokines, that IL-37 and HGF, and it blocks also the pro-inflammatory cytokines actions, which is triggered by this virus. So it neutralizes this, and at the same time, M1 changes to M2, and this secretes the IL-10. Here, TH1 changes to TH2, T helper cell we say, and that also secretes good cytokine, that is IL-10, and blocks all these bad cytokines. So this way it is start repairing the alveolar cell. And this mesenchymal stem cell here causes angiogenesis and this KGF. So this also helps in the removing of the alveolar fluid. Because of the infection, a lot of pro-inflammatory cytokines and fluid start filling in the lungs, so that hampers the exchange of the oxygen. So this also clears the lung fluid, so lung can breathe properly. So important point is here, which I want to discuss, that it helps at two stages. First, blocking the pro-inflammatory cytokines and also repairing the lung tissues. So this happens once this infection is there of the COVID-19. So it tells very clearly that COVID-19 infection may be managed using the mesenchymal stem cell. And in fact, there are several reports, including our report, and we treated few patients who were suffering from the COVID-19 infection. So that is one part. But let's see, because COVID-19 also causes a lot of problem. And once the patient is rescued from the COVID-19 infection, we see that still the patients are having the effect of the COVID-19, that is the post effect on different organs. And organs are still compromised. And particularly the old people who came out from the COVID-19 infection, but is still having the problem of multiple organ function. So second part, which is very important also, that how this COVID-19 affect the multiple organs and how we may rescue the post-COVID patient using mesenchymal stem cell. Here I am sharing you another photograph with the very complex signaling pathway, and that is telling the COVID-19 pathophysiology, potential disease mechanism, and multi-organ treatment. So let's first understand how the COVID-19 infect and create problem at different level and even in different organs. So this is the COVID-19, as you know, that infects the lung and then create the endothelial dysfunction. And because it ruptures a lot of cells and a lot of cell debris and all these things released. So because of this, it creates the thrombosis and the coagulation inside the blood capillaries, and then create microvascular dysfunction. And once the capillaries and blood supply is blocked, it may create heart problem, liver problem, kidney, brain, every single organ may get affected. At the same time, because of this damaged lung, then inflammation, then inflammatory cytokines, as I explained in my previous slide, all is upregulated, including the C-reactive protein and lactate dehydrogenase, ferritin, and all these things. Then huge cytokine storm, that is well known, inflammatory cytokine storm, and that also creates big problem for each and every single organs. So this is the real problem created by COVID-19. And even the patient is rescued using the classical treatment, that the organs of those patients are still compromised. So how to really manage this? Because we see a lot of old patients suffering from this, and they are unable to get the normal function of their organs after the COVID-19 infection. So we see once we inject the mesenchymal stem cell in the bloodstream, it goes and blocks all this pro-inflammatory cytokines action and release the anti-inflammatory cytokines. So that is neutralizes. So the cytokines storm is not there. And because of that, the microvascular dysfunction is not there, because all other organs are saved, because there is no pro-inflammatory cytokines which are going to create problem for all these organs. At the same time, this mesenchymal stem cell, as I told, clears the lung fluid. So it helps the ARDS, that is acute respiratory distress syndrome, and keep the exchange of oxygen at normal levels. So COVID-19 automatically goes away. And once the person is coming out from this COVID-19 infection, this mesenchymal stem cell also secretes the cytokines, which triggers and helps in the regeneration of damaged tissues. So this way, once mesenchymal stem cell is infused in the bloodstream, it may help even the post-COVID patient. And probably this is the only way to help the post-COVID patient, and particularly the old patient who came out from the COVID-19 and is still struggling to get their normal organ function and day-to-day life. So this can be the wonderful way to manage this post-COVID patient as well. Thank you very much for listening, and see you in my next talk. Thanks, bye.
Creating a positive and significant impact for human race is our primary goal. From research to treatment is our purpose.